Hello, everyone. Welcome to Candid Conversations, real people, real stories, real impact, a podcast from 120 under 40, the new generation of family planning leaders, where we talk to family planning and reproductive health champions from around the globe and take a deep dive into current topics in family planning and reproductive health, as well as the personal journeys of our family planning champions, the challenges they face, what excites them about the future, and advice for up and coming leaders. We are thrilled to welcome back for episode 10, where we meet one of our 2021 Ingenuity Fund winners, Simon, and discuss his project. Before we get started, don't forget to subscribe to our YouTube channel. The link will be provided in the description of the podcast. And be sure to hit that notification bell to be the first to know about upcoming episodes. Without further ado, I'll allow our guest to introduce himself and his exciting Ingenuity Fund project. Welcome.
Thank you so much, Jordan. Yeah, my name is Simon Manga, and I'm based in Cameroon. I'm a reproductive health specialist. I work for a faith-based organization, one of the largest faith-based organizations in Cameroon, called the Cameroon Baptist Convention Health Services. And currently, I work as Deputy Director for the organization in charge of clinical services. But away from that, my major work has been research and clinical care. Research in the domain of women's reproductive health. And I've been doing work on cervical cancer prevention and family planning. So briefly, that's what I can say about myself.
Perfect. Welcome, Simon. So we would love to start off by hearing a bit about your 2021 Ingenuity Fund project. Tell us the title, what it's all about, anything exciting you've learned from it, or any challenges you faced.
Yeah, my Ingenuity project is titled Use of Peer Leaders to Enhance Family Planning Uptake Among Female Sex Workers. Now, female sex workers have the highest need or the highest unmet need of family planning, not only in Cameroon, but in most of Africa and probably worldwide. Because when we look into the literature of female sex workers and induced abortions, it's very, very high. And this is just because they don't have access to family planning. And so in my Ingenuity project, my thought was how to carry family planning to the doorstep of these female sex workers. You know, we have family planning clinics all over, and we expect that everyone will come to the hospital to access these services. And for one reason or another, female sex workers may not feel comfortable leaving their areas to the hospital to get family planning services. Sometimes they are not even aware that some of these services exist. So I thought that if we carry family planning services to right to where they are, right to where they work and where they live, they are going to accept it. And my first thought was using their peer leaders, because in Cameroon we have different hotspots which are led by peer leaders who are also sex workers. And so my first thought was, if we train these peer leaders and empower them to be able, like agents of family planning, to be able to do basic counseling and even to provide sub-methods and to refer their peers for other methods, it's going to work. So that is the model that I have been piloting. And the major challenge that I've had is that of funding. The project that I designed was beyond the allocated funding. I got just 10,000. No, it's not just, it's huge. I really appreciate, yes, the $10,000 for that project, but just I was not able to meet my needs. But fortunately, I applied for one volunteer, a US couple, they call them Dr. and Mrs. Tom and Edie Wealthy. They are based in the US. They have been volunteering with the CBC Health Services, with our work in family planning, in reproductive health here in Cameroon. And they have accepted to support the project. So they have donated an additional 5,000 to this project, and that is going to give a great push, yes, for this project. And I'm so grateful for this additional funding. Yeah, so we have the training already. We have done the training. We have trained the peer leaders in one town in the capital city, that is Yaoundé in Cameroon. And we have trained 7 of them. And they were so excited to receive this training. And they are so committed to carry family planning forward. And we did the first part of the field work, where they were, because of limited funding, we said they should enroll, because now we have 2 types of methods, the long-acting reversible contraceptives and the short-active method. So here we are providing the long-acting reversible contraceptive at an organization called Horizons Femmes. This Horizons Femmes is an organization that caters for the female sex workers. So instead of asking them to come to our hospital for the long-acting methods, we prefer to say that they should come to Horizons Femmes, where they are used to the environment, they are used to the people, and we provided the long-acting methods to them right there. And these were the implants. The implants, we had Implanon and Jadel, and the IUD, which we have the Copper T 380A. So these are the methods we advertise as long-acting methods for these women. And we commission every peer leader to bring 10, to refer to just 10 sex workers for the long-acting methods. And this went on so well. Within a week, just few days, all of them were able to come with their 10 sex workers, and they received the long-acting methods. And at the same time, we had empowered the peer leaders to be able to provide short-acting reversible methods. For example, Sayana Press. Sayana Press is an injectable, or is a subcutaneous DMPA, depot methoxy progesterone acetate. You know, for several years, we have been using the injectable, which is the intramuscular. But of recent, we have this subcutaneous injection, which a woman can even self-administer. So we train these peer leaders on how to administer these. And we also train them on contraceptive pills and then condoms. So we provide them with these methods, and they go around the hotspots supplying the methods. But for those who needed the long-term methods, the implants and the IUDs, they will refer to us at the Horizons Femmes, where we have successfully, within a couple of days, administered the long-acting method to 70 of these female sex workers. So briefly, that is where we are. And our next step will be to do a focus group discussion. When we did these family planning methods, we administered a questionnaire, a pre-test questionnaire for the sex workers, what they knew about family planning. And this questionnaire was administered by the peer leaders before giving the education, before giving the counseling and the methods. So we also tested them for pregnancy with a urine pregnancy test to ensure that they were not pregnant before receiving the method. So in 3 months, we are going to get them back. We are going to administer a post-test to see the knowledge difference between the pre-test and now that they receive counseling and they receive the methods. So we are going to do that as a focus group, and we say each of the 7 peer leaders will come with 1 sex worker. So they are going to choose the best among their cohort, and we are going to sit and have a focus group with them. Mm-hmm. And we are also going to repeat the pregnancy tests in 3 months, just to be sure that nobody got pregnant after receiving the contraceptive method. And at the end, we are going to also do a focus group discussion for these peer leaders. We want to find out their challenges, their experience of becoming agents of family planning among their peers. And we are hoping the objective or the bigger goal is that we'll be able to come up with a model. We'll be able to design a model to use peer leaders as agents of family planning among female sex workers. So briefly, that is the project which I've been working on here in Cameroon.
That's fantastic. That has sparked a lot of questions that I'm curious to follow up you on. One of the questions that came to my mind as you talk through your Ingenuity Fund project is about meeting people where they are. And so I would love if you could talk more about the importance of working with the community partners like Horizons Femmes and being able to meet female sex workers or communities and populations where they are, and the importance of that in your work as well as general sexual reproductive health and rights work.
Yeah, thanks a lot for that question. I've had experience working with the female sex workers and with this Horizons Femmes since 2020, when I got a grant from Prevent Cancer Foundation to screen female sex workers for cervical cancer and human papillomavirus and to treat those with pre-invasive lesions. And that was the strategy that I used. And I saw that it works. Mm-hmm. It works better. If we had to ask these female sex workers to come to our clinic, to come to our hospital, I'm not sure we would have had this type of response. Mm-hmm. But because they have been working with Horizons Femmes, and the Horizons Femmes is located around their area of work. So it's just close to them. Yeah, their hotspot where they come out and do sex work. That is where the Horizons Femmes clinic is located. Mm-hmm. And they are so used to the clinic. They are used to the workers. They feel free while they are there. And I thought that taking the services right to where they are will encourage them than inviting them to leave that area and come elsewhere to meet a strange environment, strange people. And so I think it's a strategy that I just discovered that it works really, really well.
Perfect. And from just a little bit you've been talking, I think I've gotten a glimpse into the breadth of your journey and career in the field of sexual and reproductive health and rights. I would love to hear a bit more about how you got to where you are. If there's a young person who looks at you, Simon, and is like, I want to do that. How do they get there? What has been your journey?
Yeah, thank you so much. I started my career as a state registered nurse, and I was recruited after my training in basic nursing. I was recruited by this faith-based organization, the very CBCHS where I'm working for till today. That was in 2002. And I was sent to work in prevention of mother-to-child transmission of HIV. You know, in those days, HIV was like a death sentence. There was no drugs. Maybe elsewhere, but in Cameroon, we didn't have access to drugs. And all what we had was just drugs to prevent mother-to-child transmission, which were administered in labor. And that was the best we could offer. And we formed a support group for these women living with HIV from the PMTCT program. And we were encouraging them each time how to live positively, giving them health education. And one of the things we were encouraging them was avoid subsequent pregnancies. If you avoid subsequent pregnancy, because pregnancy is not healthy with HIV. It's going to make your HIV worse. That is the information we're giving them. But in less than no time, we saw them coming back with repeated pregnancies. So it's like we needed to do something. I needed to do something just beyond education. That's why I started thinking of family planning. These women have high need for family planning. And while working with them, I realized that a lot of them also had sexually transmitted infections. A lot of them had cervical cancer. And I thought that these women, they need a lot in reproductive health. And so that is how I started developing interest to further my career in the field of reproductive health in order to meet the needs of these vulnerable women. And so from there, I went to school over and over and over, and I did a lot of courses on sexual and reproductive health. Yeah, so that is my career pathway.
Wonderful. So we've talked a bit about the evolution of your career as well as kind of the field and the setting. So what excites you that's coming up, that's happening now in family planning? Are there any trends, any new movements or platforms that excite you in this space?
What excites me most about family planning is just within the organization where I work, because I work for a faith-based organization. After I did a diploma in reproductive health, I came back to the organization and I was appointed to run the family planning program within the organization. And when I get to the family planning program, what I noticed is that it was forbidden for any person, any woman to receive a method if she was not married, because it's a faith-based organization. They have to maintain Christian norms, Christian values. Sex is only for those who are married. If you are not married, don't pass here. If you come there, they'll send you away. And even for those who are married, you are supposed to show an evidence of marriage, that you come with your husband, or you come with a marriage certificate, or you come with a note from your husband. And so family planning services in the organization was so timid, really, really timid. And when I came on board, that was the first thing I had to fight against. I said, no, family planning is a service. Family planning saves lives. It's for everybody, irrespective of age, irrespective of marital status, irrespective of whatsoever. Anybody who needs family planning has to access it. Even though we are a Christian organization, we have to stay professional. And those were some of the arguments I put forth. It was a big battle because a lot of colleagues, a lot of missionaries, a lot of pastors resisted that move. But with ongoing teachings, with ongoing education, with ongoing sensitization, I think we have been able to break through. And today in our organization, family planning is open. Anybody can come into family planning and will take the method of her choice. And that is one of the things that I'm so grateful for. And it was in 2015, I started an organization, a consortium of faith-based healthcare organization. And I brought together up to 7 faith-based healthcare organizations with support from an organization in the US called Christian Connection for International Health,
Mhm.
the CCIH. So we're able to like push family planning through the faith base. Because in my thoughts, I was like, if my organization was preventing young people from getting family planning methods, probably other faith-based healthcare organizations were doing the same. So bringing these faith-based healthcare organizations together, we're able to like break that barrier, and we were able to push family planning through and talk about family planning freely, even in the church, because the people that have unwanted pregnancies, they also come from the church. The people who contact sexually transmitted infection, they come from the church. So the church cannot pretend to be indifferent when these things are happening right with their members. And so, unfortunately, this organization ran just for a short while, and I traveled to the US. This started did this between 2014 and 2016. And in 2016, I had to travel to the US for my PhD. And that is how the organization gradually died. But now that I'm back in Cameroon, I'm trying to work it up, trying to gather people so that we can get back to and continue from where we ended.
That's quite amazing. And it leads me to a lot of other questions. I'm trying to sort out all the questions I have that you keep sparking. I guess one of the questions I have is listening to you and being able to break barriers and break down the challenges within a structure that is very historically entrenched in what they believe. What advice do you have for other youth advocates that are working in spaces or structures that don't fully allow them to express or achieve the sexual reproductive health and rights that they would like to see?
Well, I think the only advice is to sensitization.
Mm-hmm.
Because sometimes people are not aware of these things. Like I started by sensitizing even the leaders of my organization. First of all, to make them understand that family planning can reduce maternal mortality by 1/3. And maternal mortality rate in Cameroon has been really, really high. And we are showing the people, this is the data, it's showing that if we engage in family planning only, we are going to cut down this high rate of maternal mortality by 1/3. And so we are going to save lives. So that is how people started buying in.
Mm-hmm.
So yeah, so I think we need to bring the argument from a scientific perspective.
Mm-hmm.
Yeah.
Perfect. And then my other question is, so you talked about kind of some of the challenges around working within a faith-based organization, but I'm curious in hearing more about what is the role of faith-based organizations, especially as it relates to contraception.
Yeah, the faith-based organization, to me, it has a very great role, very big role to play in family planning. Because first of all, the church is a very organized structure, and the church believes a lot in their leaders. Mm-hmm. So if we empower church leaders in what we are doing and they buy in, it can make a lot of difference. Like if we get the pastors to be the one in front, we educate them on family planning. We get them also talk to their Christians about family planning. I think they'll take it more serious than if it was just a healthcare worker who left the hospital and was talking about it. You know, spiritually, that's have a lot of impact, a lot in their society. So I think passing through the church leaders, and I've used this even in other projects, like vaccination against human papilloma virus, which the population has been so, you know, they have been so scared, so skeptical about the vaccines. But when we take the vaccine and pass through the church, you see the the uptake was so high.
Mhm.
We have even gone to churches, do vaccinations right inside the church, and people will accept. But the same vaccine that will not be accepted in the hospital, in the schools, but in the church, because you have passed through the pastor
Mhm.
and he has given his support, everything works very smoothly. So I think that our spiritual leaders have a lot of force, and we
Mhm.
need to work together with them.
Do you
Yeah.
have recommendations or thoughts of things you've been kind of turning around how youth and faith leaders have worked together, or how can they better work together, especially to achieve better access or more equitable access to contraceptives?
Oh, yeah, is to use the church,
Mhm.
just to use the church to sensitize the pastor
Mhm.
and show the pastors the scientific reasons why we need family planning.
Mhm.
And then let them give an opportunity for us to talk with the young people, beginning in the church.
Mhm.
Because most of our environment, our society, especially here in Cameroon, is so religious. You find almost everybody is affiliated to one religious group or another.
Mhm.
And so if we pass through our religious leaders by, first of all, sensitizing them, get them to buy in, and then we can push through.
No, I think it relates a lot back to what we talked about originally with your project around meeting people where they are, meeting them within their communities and working within their community structures, so that they can feel empowered, and can have advocates within their communities. So now I want to shift a little bit to focus on contraception. So this podcast is coming out in celebration of World Contraception Day, 2022. So I would love if you were able to speak a little bit more on how to elevate youth voices, especially when it comes to their perspectives, concerns, priorities around contraceptive.
Yeah. For World Contraceptive Day in my organization, we usually provide free family planning services. That day, we say everyone, you can come, get a method of your choice and not charge, or maybe we reduce the charges so that it becomes very available.
Mhm.
Those are one of the ways that we usually celebrate World Contraceptive Day.
Mhm.
And for youth, it's just to keep telling youth that they have a right to contraception.
Mhm.
And one other barrier that I realized when I started working in the family planning was the family planning clinics were not youth friendly,
Mhm.
because the people who were providers, who were workers in these clinics, were usually these mothers who have worked for several years and they're about to retire. They are no longer in the reproductive age. They are menopausal. Those are the women working in family planning. That already makes the environment hostile for the younger girl. Because if a youth comes there, and you see a mother, and it's like you want to start telling your mother, I've been having sex, it's a little bit difficult. It's scary. Some of them want to stay away. But when we bring younger people to run those services, when they come, they meet their friends, they meet people that they can easily talk together. They have common challenges. They'll be more open to come. And that's why one of the things that I advocated when I started working in family planning in the CBCHS, that let us get young people in the family planning. It is not the best to keep, you go to the clinic, you meet 3 mothers, or as providers, it scares young people. We need to make the clinic youth friendly by putting young people, we train young nurses who can render services. So when the young people comes in, they feel relaxed in
Mhm.
the presence of their peers.
Mhm.
Yeah.
Have you seen success in that advocacy of getting young people within clinics?
Oh, yes, yes. I've even had testimonies where young people were like, oh, I could not go to that clinic because I was afraid of that mother. But now that this young girl is there, now that this young guy is there, I can go in, we can talk freely. Yeah.
Awesome. Would you have advice for other advocates who work with young people and are trying to elevate the voices of young people?
Yeah. The advice I can give is just that every advocate for young people should know that young people have their rights. And young people, because there are some advocates, we are advocating for the health of the young people. Some just go and say, hey, abstinence is a way to go. Abstinence is the only way. If you don't do abstinence, you are finished. And I don't give other options. But while abstinence remains the best, not everyone has the ability to abstain. So we need to catch up with everyone. Those who can abstain, we encourage them. That is the best. Those who cannot abstain, this is how you can go to prevent yourself from sexually transmitted infections and to prevent yourself from unwanted pregnancies. Yeah.
Great. So you've talked a little bit about some of the challenges within Cameroon about providing access to contraceptives to youth. Are there any other challenges that you've seen or any other successes or transformations within Cameroon that you've seen around access to contraceptives, especially for youth?
Yeah. I think the stigma associated to, especially condom, is dying. Because over the years, in the past, it was like somebody who touches a condom, even to talk about condom, is a very big taboo. It was a taboo subject. And now you find young people living in their gatherings, they can talk about condom freely. You can stand and talk about condom amongst youths, and they will sit there and listen. As in the past, when you want to talk about that, you find people walking out of the hall because they have brought in a taboo, something that people are not supposed to talk about. So I think that with continuous sensitization, people are becoming more and more open-minded and they are able to accept some of these realities.
And I'm curious, you've talked a bit about sensitization. And so I'm sure throughout the course of your career, you ran into people or have encountered people who take a bit more work on sensitization or it takes a little bit more effort. What advice do you have people for kind of persevering and continuing? Because I know it can be a lot of work sometimes, continuously sensitizing people.
Yeah, what I want to say is that behavior change is very difficult. If somebody has to change behavior, don't expect the behavior to change automatically. It goes gradually. And so that is why if we are going out for sensitization, we have to be patient with the people and we have to be persistent with the information. The more they hear, the more they'll keep thinking and reflecting about it. And sometimes when you sensitize somebody and the person even accepts the message, after some time, that message actually goes down. The person begins to lose, I don't know how I can put it, but the impact of that message gets lost over time. So it needs continuous reminder for the people to be awakened and continue to stay focused on the behavior, the new behavior they have adopted. So sensitization needs patience and it has to be consistent. If you are engaged in sensitization, never give up, just keep on. And someday you'll see the result.
Here you go. That's good advice. You also talked about forming kind of a coalition, especially of faith-based organizations. Can you talk a little bit about the challenges that come with assembling a coalition of such size, but also some of the successes that you've been able to see from that?
Yeah, it has not been easy. It was never easy bringing those 7 faith-based organizations together. We had to make a lot of advocacy with their leaders. This is what we want to do. We want to approach family planning as faith-based organizations from a united front. And some accepted, some did not accept. And when we came together, it worked so well because we also had funding support from CCIH. And when that funding support ran out, it became so difficult for us to come together again. Because now we see this organization, when we have meeting, you have to sponsor your members to the meeting, and then people started becoming so reluctant. That has been the major challenge. But for the success, the faith that coalition have been able to approach family planning from one dimension. For example, we have family planning commodities through donors to the government, and then the government donates to the different organizations. So in this our coalition of 7 faith-based organizations, we went to the government as one to get family planning commodities for all of us, and we take and distribute amongst us. And when we are reporting, we report as one body. That also made the government to see some seriousness among the faith-based organization.
I guess what I'm learning and hearing is the work isn't necessarily easy, and there's always challenges and barriers, but there's power in perseverance, there's power in collective action, and there's a power in using your voice. Yeah. I think that's what I see from your career just so far. You have so much more left to go. Yeah. So as we wrap up this episode, I wanted to leave a little bit of space. Is there anything else you want our listeners to know? Anything else you want to share? Any advice that you want to give to younger leaders?
What I just want to highlight is that I'm trying to target in my career now, I'm trying to target the most vulnerable population. Like female sex workers, they have a lot of health disparities because they hide, they don't go out, they don't like people to see them out of their area of work. So if you really want to create an impact in that group, let us take our services closer to where they are. They need those services. Abortion rates are very high among female sex workers. So I just want to encourage others who work in family planning that let us not forget the vulnerable ones. Those ones who cannot come and meet us, let's go and meet them. You will create a better impact. Yeah.
That is a wonderful way. I don't think I could have ended that any better. That was wonderful. Thank you so much for joining us. This has been an extremely insightful and interesting conversation. And I think it's a conversation that a lot of young leaders can take with them in their journey through their careers. So thank you so much for joining us. We are excited to welcome you to the World Contraception Day webinar that we'll be hosting around the Ingenuity Fund winners. And to our audience, we will see you next time. And don't forget to subscribe. Thank you.
Thank you.